welcome to this deep dive. We're getting into something really quite fascinating today in feline health. Feline paraneoplastic alopecia.
Right.
Now, that might sound like, just another cat skin issue.
Yeah, it sounds technical.
But believe me, this is one where the skin signs are actually a huge clue pointing to something much more serious happening inside the cat.
Exactly. That's the key thing here. The hair loss, the skin changes, they're not really the primary problem. They're more like a signal flare.
A signal flare, I like that.
Yeah, a strong sign that there's an internal cancer lurking. The skin is basically acting like an early, well, maybe not so early, warning system.
Right, a warning for a deep problem. It's amazing how the body works sometimes, isn't it? An external sign just screaming about something internal.
It really is.
And the main cancer we're talking about here is pancreatic adenocarcinoma, that specific type.
That's the most common one, yes. Though sometimes it's linked to bile duct cancer or liver cancer too. Less common, but it happens.
And the connection. How does the cancer cause these specific skin issues? Do we know?
Well, we don't know exactly. The leading theory involves cytokines.
Okay.
These are like messenger molecules between cells. The idea is the cancer releases certain cytokines that somehow mess with the hair follicles.
Mess with them how?
They seem to cause the follicles to atrophy, to shrink, basically, and then the hair falls out.
Yeah.
But it's, still an area of active research. We're piecing it together.
Okay, so let's dig in a bit more. Which cats actually get this? Is it any cat?
It's interesting, actually. Pretty much all the reporting cases are in domestic short-hair cats.
Really? Just domestic short hairs?
Almost exclusively, yeah. And age-wise, it tends to hit older cats. You're looking at a range of maybe 7 to 16 years, but the average, the median, is around 13.
13, so definitely senior cats.
Yeah, getting up there. Which does raise that question, why domestic short hairs? We don't have a solid answer, but it strongly suggests some kind of a genetic predisposition in the breed,
That makes sense. Some underlying susceptibility.
Exactly, to this specific kind of paraneoplastic reaction.
Okay, so for someone listening who has an older domestic short hair, what are the specific signs? What should they or their vet be watching out for?
Often the very first things are subtle. Maybe the cat's just not eating as much as usual, a decreased appetite.
Okay.
And that's often followed by pretty rapid weight loss, sometimes surprisingly fast.
Even if they're still eating a bit?
Yeah, sometimes the weight loss seems out of proportion. And then comes the shedding, excessive shedding.
Right, but cats shed a lot anyway. How would you tell the difference?
It's usually more dramatic. It progresses quickly to actual bald patches, not just thinning.
Okay, noticeable patches.
And here's a key thing. Itching or pruritus is variable. Some cats might groom more, maybe they're uncomfortable, but many aren't overtly itchy like you see with allergies or parasites.
Ah, okay, so not necessarily scratching all the time.
Not necessarily, but what is really characteristic is how easily the remaining hair pulls out. Like you could gently tug it and it would just come away. The follicles aren't holding on tight.
Wow, okay. That sounds distinctive. Where does this hair loss usually show up most?
The classic pattern is on the underside, what vets call the ventral surface. So the neck, the belly, the inside of the thighs. That's where it's usually most severe.
The underside, got it.
And often in those areas, the skin takes on this very peculiar glistening appearance, almost like it's polished or wet looking, but it's dry.
Glistening. That's a strange description for skin. What causes that?
We think it's because the very top layer of the skin, the stratum corneum, the barrier layer,
Right.
It might be peeling off or even missing in patches.
Yeah.
That exposes the layer underneath and gives it that shiny look.
I see.
And the skin itself, despite the hair loss, has this weird feel. It's shiny, as we said, often inelastic. It doesn't snap back quickly if you pinch it, and it feels thin. But, and this is important, it's usually not fragile.
Not fragile, even though it's thin?
Right. It doesn't tear easily like in some other conditions, like Cushing's, for example. That's a key difference.
Okay, that is a really crucial distinction for diagnosis.
Absolutely. And sometimes, though not always, you might see these little dark spots develop in the bald areas. Like freckles. We call them gray lentigen.
Lentigens, okay.
And one other thing, don't forget the feet. The foot pads can get involved. They might become cracked, fissured, maybe scaly, and that can be painful.
So the cat might be reluctant to walk.
Exactly. You might notice them limping or just hesitant to move around. So yeah, key things. Weight loss, hair easily pulled out, baldness underneath, that glistening, non-fragile skin, and maybe sore feet.
That's a pretty specific cluster of signs. So if a vet sees a cat with some or all of this, What else are they thinking it could be? What's on the differential list?
Oh, definitely. Ruling things out is a huge part of it. You'd think about hyperadrenocorticism, Cushing's disease.
Mhm.
That can cause hair loss, but the skin texture is usually different, maybe thicker, sometimes fragile, and you often get other signs like drinking and peeing a lot. Not typical here.
Okay. What else?
Hyperthyroidism, overactive thyroid, causes weight loss, coat changes, sure. But those cats are usually eating more, ravenous even. Opposite of the decreased appetite we often see here.
Right. That appetite difference is a big clue.
It really is. Then there's hypothyroidism, underactive thyroid. Super rare in cats, honestly, and doesn't cause that glistening skin.
Okay.
Feline symmetrical alopecia, that's usually self-inflicted from overgrooming. Stress, allergies, whatever. The hair isn't typically easy to pull out like this, and the pattern might differ.
Makes sense.
You might consider a thymoma a chest tumor. That can cause skin changes, sometimes scaling or thickening, but again, different look usually, and you might see a mass on chest x-rays.
And what about the really common skin stuff? Lights, ringworm?
Absolutely have to rule those out. Dermatocosis, Demodex mites, usually causes crusting, inflammation. Dermatophytosis ringworm, that usually involves broken hairs, maybe crusting, not this widespread shedding and systemic illness.
This systemic illness being the weight loss and poor appetite.
Exactly. Those systemic signs aren't typical for just ringworm or mites. Alopecia areata is another one. Immune system attacks hair follicles, but it's usually patchier, less ventral, and again, not the weight loss.
So it sounds like the combination of the specific skin changes plus the systemic signs is really key.
Precisely. You also think about telogen effluvium stress shedding, basically. But the follicles don't shrink like this. Skin fragility syndrome, well, the name says it. The skin is super fragile, tears easily, not what we see here. And another one, superficial necrolytic dermatitis, has very different microscopic skin changes.
Okay, quite a list to work through. So how does the vet actually confirm feline paraneoplastic alopecia? What are the diagnostic steps?
Well, the first step is usually baseline tests. Routine blood work, maybe a chemistry panel, complete blood count, and a urinalysis.
What do those show?
They might not show anything specific for this condition, but they're crucial for ruling out other things like kidney disease or infection, and just getting a sense of the cat's overall health status.
Right, ruling out the differentials.
Exactly. Then you'd likely run endocrine tests, check thyroid hormone levels, maybe do an ACTH stimulation or dexamethasone suppression test if you're suspecting Cushing's. Rule out those hormonal causes.
Okay.
Skin scrapings are a must to look for mites like Demodex, and a fungal culture for ringworm. Basic dermatology workup.
Makes sense.
You might also do skin cytology, pressing a slide onto the skin to pick up cells and look under the microscope. Sometimes you find secondary use, malignancy, which can add to itchiness if it's present.
So that's ruling out infections and parasites. What about finding positive evidence?
That's where imaging comes in. Abdominal ultrasound is really important.
Looking for the tumor.
Yes, looking for a mass in the pancreas or signs of spread like nodules in the liver or on the peritoneum, the lining of the abdomen.
Can ultrasound always find it?
Not always, unfortunately. Pancreatic tumors, especially, can be quite small or hidden, so a clear ultrasound doesn't completely rule it out, but it's a key step.
Okay. What other imaging?
Chest x-rays. Thoracic radiographs. You need to check if the cancer has spread to the lungs or the pleura, the lining around the lungs.
So imaging gives strong clues, but it sounds like it might not be 100% definitive on its own.
Often that's the case. For a more definitive diagnosis, you usually need tissue samples. A skin biopsy is almost always done.
What does the biopsy show?
A pathologist looks at it, and there are characteristic changes, things like non-scarring alopecia, severe shrinking atrophy and miniaturization of the hair follicles, a thickened epidermis called acanthosis, maybe that missing stratum corneum layer we talked about, and some inflammation.
So the skin biopsy is pretty suggestive.
Highly suggestive, yes, but it confirms the skin syndrome, not necessarily the specific internal cancer type directly.
Ah, okay. So how do you confirm the actual cancer?
That usually requires getting a look inside, either with laparoscopy keyhole surgery with a camera or a full exploratory laparotomy, which is open abdominal surgery.
To see the pancreas directly.
Exactly. To visualize the pancreas, liver, bile ducts, and take biopsies of any suspicious masses or nodules. Examining that tissue is what confirms, okay, this is pancreatic adenocarcinoma, or whatever the primary tumor is.
Right, that makes sense. That gives the definitive answer. So we know the signs, the diagnosis.
Yeah.
Let's circle back to what's actually going on inside, the pathology.
So, as we said, the main culprit is usually pancreatic adenocarcinoma, that specific type of pancreatic cancer.
Okay.
Less often, bile duct carcinoma or hepatocellular carcinoma, which starts in the liver cells. But the pancreas is the most common primary site.
And the spread, metastasis.
Unfortunately, yeah, that's very common by the time these skin signs are obvious. The cancer often spreads to the liver, the lungs, the pleura, and the peritoneum.
So it's often quite advanced already.
Frequently, yes. That's why those skin signs are such a serious indicator.
Which leads us to the tough part. Treatment and prognosis. What can actually be done for these cats?
Well, the prognosis is generally poor, very guarded.
Because of the metastasis.
Primarily, yes. Theoretically, if you could catch the tumor very early before it spread and surgically remove it, like with a partial pancreatectomy, that could potentially be curative. The skin signs might even resolve. But realistically, that scenario is rare because metastasis has usually already happened by the time we diagnose it based on the skin.
So surgery isn't often a realistic option.
It's often not curative, unfortunately. And as for other treatments, chemotherapy, other medications, there's really no reported success in treating this specific paraneoplastic syndrome or the underlying cancer effectively.
Wow. That's really difficult news for an owner to get.
It truly is. It's a devastating diagnosis. These cats tend to go downhill fairly quickly once the skin signs appear.
So what happens then?
Sadly, because of the poor prognosis and the progressive nature of the disease, euthanasia is often the kindest option to prevent suffering.
Right. Quality of life.
Exactly. Now, some owners might opt for supportive care for a time. Things like offering really tempting, high-calorie food, maybe even a feeding tube if the cat isn't eating, just to provide nutrition and comfort.
But that's not treating the cancer itself.
No, absolutely not. It's purely palliative, keeping the cat comfortable. But you have to understand, the underlying disease will progress.
So even with that supportive care, what kind of time frame are we looking at typically?
It's usually quite short. Most cats pass away or are euthanized within, say, 2 to 20 weeks after the skin lesions first become noticeable.
2 to 20 weeks. That's incredibly fast.
It is. And follow-up imaging during that time, if pursued, often just confirms the spread, the progression of the metastases.
This has been, wow, a really sobering but important deep dive. If you had to boil it down, what's the single biggest takeaway message for people listening?
I think the absolute key point is that feline paraneoplastic alopecia, while uncommon, is a powerful red flag. These very specific skin changes, especially in an older domestic shorthair, should make you think serious internal cancer.
Okay.
Recognizing those signs, the weight loss, the easily pulled hair on the underside, that strange glistening skin, it's crucial for getting a prompt veterinary workup. Even though the outcome is often poor, knowing what you're dealing with is important.
Absolutely. It really highlights how interconnected everything in the body is, doesn't it?
It really does.
Even if we don't fully grasp the why yet, how this specific cancer causes these exact skin signs, it's a stark reminder that sometimes the body signals major problems in really unexpected ways.
Yeah.
It kind of makes you wonder, what other subtle signs might our pets be showing us that could be clues to something deeper going on, something to think about?
Definitely something to keep in mind.
Well, thank you for walking us through this complex and, frankly, quite tough topic. Really appreciate the insights.
You're welcome. Important information to share.